I'll turn to you. When you were asked to define infanticide, your own words were, it is when a baby or infant is killed. The Born Alive Infants Protection Act of 2002 clarifies that infants who were born alive during abortions or attempted abortions are afforded all legal protections enjoyed by other persons in the United States.
Yes.
Please tell me if you would support amendments to the federal Born Alive Infants Protection Act to protect infants born alive infants into these incredibly vulnerable circumstances by providing a requirement that abortion providers or their staff immediately call 911 emergency transfer to a hospital of the infant born alive at the clinic, and to also provide criminal penalties, including prison time, and fines for physicians and medical professionals who do not provide medically appropriate and reasonable care to a born alive infant.
If you're talking about a viable fetus that's born alive.
Talking about born alive, using
a viable fetus.
Talking about born alive.
A viable fetus.
I'm talking about born alive.
Okay, so you're saying pre-viable.
I'm talking about born alive.
Pre-viable.
I'm talking about born alive. I don't know what you don't understand. We're talking about a child who's born and is alive. Is that hard to understand?
That is not hard to understand, but the question is it a viable fetus? If it's not viable, nothing will save it.
So viability transcends being born alive?
Like the Supreme Court, I believe that the proper line we draw is at viability, yes, because
so
if you
whatever that legal term is, viability is, if the child can do valet, if they haven't achieved that viability thing, then even though they're born alive, then all of a sudden that transcends the whole question. In other words, let me ask it again. For a child born alive, a child born alive, that means breathing, moving around, born alive child. Do you think that we should have some amendments to our Infants Born Alive Child Protection Act to require that 911 be called to provide a transfer to a hospital of this infant born alive, and provide criminal penalties, including prison time and fines for those physicians or medical professionals who do not provide medically appropriate and reasonable care to a born alive infant?
I think our law already protects born alive infants.
So you're not going to answer the question?
I am answering your question. Calling 911.
Let me get here then. If a child is born, let's say, at 5 months, we'll be specific. 5 months.
5 months. Okay.
Yeah.
So
5 months, and the child is born alive. Should that child then be afforded protection after they're born alive?
Yes.
Okay, but not if it's 5 minutes earlier, before they move down the birth canal. They're not afforded protection, correct?
Sorry?
In other words, if they're born alive at 5 months, they deserve the protection, correct? That's what you just said.
If they're a viable fetus, yes,
no,
absolutely.
You didn't say that. You said that they should be protected if they're born alive. Now, if you changed your mind, that's fine. You can tell us.
I didn't change my mind. I think you're confusing me. So if it's born alive and you have a viable fetus, they deserve protection, and they are, yes, they are protected.
But if they're born alive and somebody arbitrarily says they're not viable, then they're not protectable.
If they're not viable, they will not survive. And so whether you have a federal law to call 911 or not, I don't think will protect them.
Well, how do you know if it's viable without medical professionals? I mean, how do you know it's
I'm not a doctor, but doctors know.
So, but what you're saying is that the child that's born alive then is subject to whatever the doctor says. Well, this child's viable, this child's not. So we'll decide to let this one live, or we will transfer this one for medical care, but not this one.
Well, some fetuses are viable and some fetuses
the schizophrenia
are not.
of all this, Mrs. Smith, is that Ms. Smith.
You should be asking a doctor the questions about how to determine viability. First of all,
but my question to you was, if the child is born alive at 5 months, should they be protected? And you're having a difficulty answering that question, and I understand. I would have a difficulty.
Well, because 5 months, I'm not sure how many weeks that is, and also it depends on whether the fetus is viable.
Right.
Some fetuses are never
Whether they're alive or not is not the issue. It's whether they're viable. I understand. Yeah. I would like to understand.
Some fetuses never are viable. At 30 weeks, they cannot have a brain. They're not viable. They're not going to live. Would you provide aid and comfort? Yes, I think you do. But that fetus is going to die.
Provide appropriate and reasonable care.
Yes.
That's what we should do.
Yes.
All right. With that, I will now yield to